My name is Anil Lalwani. I am professor and vice chair for research in otolaryngology, head and neck surgery at Columbia University Medical Center in New York City. I've been practicing for about 25 years in all aspects of otology and neurotology. My current preference for electrodes really is the Slim Modiolar Electrode. I like the fact that it hugs the modiolus. It's easy to put in. It's smaller than the older, the Contour Advanced electrodes, though I do like that electrode for special cases, like meningitis or where I'm going to need to have some stiffness in the electrode. I like the fact that it's relatively atraumatic. Managed to preserve hearing in many cases. So ease of putting it in, size, the fact that I could preserve hearing, and the outcomes. I also like the sheath that the electrode comes in. It protects the electrode, and more importantly, as you're inserting it, the final mark, the nubbing, the white nubbing on the electrode stops at the facial recess. The reason that's important to me is because I no longer have to take my jeweler's forceps beyond the facial recess, get it stuck in that small recess if it's small, and then possibly pull the electrode accidentally back out. So I kind of like the fact that I don't have to manipulate the electrode beyond the facial recess. Well, over the last several years, both the field and my practice has kind of moved away from doing a cochleostomy. When the electrodes were bigger and patients were more deaf, it wasn't so critical that you do an atraumatic technique, that you avoid doing a cochleostomy. And I think there were also some theoretical concerns about putting something to the round membrane. And by and large now, I have moved towards round membrane insertion. Those theoretical concerns are no longer a problem. I treat every case as if there is hearing to be preserved, because ultimately, atraumatic insertion, minimizing intracochlear trauma, is going to lead to better outcome. You take a room full of 10 surgeons and you give them one task to do, they're going to come up with 10 different ways to do it. That variation may be terrific for an artist. It's not great for patient care or patient outcome. You really want to minimize variations in technique, how something is placed in, and certainly how to put in the electrode in the cochlea. You want to minimize variation. You want to minimize any chances for trauma. And therefore, as you take away some of the variability introduced by the surgeon, by some design factors such as the sheath and the other characteristics, I think it makes the electrode much safer in the hand of any surgeon. I think patient outcome at the end of the day is what we always focus on.